Good morning friends, I am Dr. Pathak. I am a consultant urologist at Lilavati Hospital, Bandra, Mumbai. We are having a prostate cancer awareness month, and today's topic I am going to educate you on early diagnosis and screening of prostate cancer. Prostate cancer is a common cancer in North America and Europe, but in last 25 years the incidence has increased in India and Asian countries. Is because of the changes in lifestyle, diet, smoking, alcohol and many other factors. So the importance being timely diagnosis and timely treatment can give you a complete cure and a normal survival. The early diagnosis is by doing a clinical examination and prostate cancer screening by doing a blood test which is called PSA, that is prostate specific antigen. This is a very easily performed blood test which is not cancer specific but elevated levels of PSA. The normal range is 0 to 4. So when the PSA levels rise, there can be a suspicion of cancer, and hence when the levels are more, you should consult a urologist so that he does a clinical examination. If required, he will subject the patient for MRI, that is multiparametric MRI, on which we come to know whether a further biopsy is required or no. In obvious patients, the biopsy is recommended upfront. So prostate cancer per se does not have any specific symptoms. So when the symptoms occur because of cancer, that means you are late. So the symptoms basically overlap with the benign enlargement of prostate. So only blood test and screening are the ways for timely diagnosis. So once PSA MRI is done, the clinician will advise the patient to undergo a prostate biopsy. This biopsy is done with the help of a transrectal ultrasound. It's an OPD procedure, very simple procedure, relatively pain-free. So one should not get worried about the biopsy. One should subject for biopsy as advised by the clinician. Once the diagnosed PSA increase may not mean that an individual is suffering from prostate cancer. It can increase in presence of infection, and there are symptoms of infection, then the clinician may not advise the patient to undergo a biopsy. So in those who have borderline rise in PSA, these patients are monitored every 6 monthly or annually depending on the levels of PSA. So once the biopsy, if it is equivocal, then follow-up PSA is required, and those who have diagnosis of cancer on a prostate biopsy are subjected for the appropriate treatment. The timely diagnosis, what I mean is when the disease is organ confined, means the malignancy is only in the prostate gland. It is curative. There are many modalities available. One of the modalities is a robotic or laparoscopic or open prostatectomy. Others are radiotherapy, and in advanced cases, you have other modalities like hormonal therapy, chemotherapy, anti-androgen drugs. So friends, don't get scared of cancer of the prostate. Timely diagnosis with timely visit to the hospital will give you a good quality of life. Those who have a family history should undergo PSA screening annually after the age of 50, but those who don't have such history should undergo a PSA screening after the age of 60 once in a year. Go to the hospital, get yourself tested, and rest assured you will have a normal life.